So is all back pain a herniation? No, I mean, is every back pain a herniation?
It is not.
Is every neck pain a herniation?
It is not.
So, there can be a lot of muscle spasms. There can be joint blockages. There are facet joints in the body's joints. These can get locked. Well, there can be beginnings of herniation, or there are different diseases of the spine. There are infections and tumors, God forbid. So, many things can happen. But of course, we don't want that. We don't want to suffer from pain. Especially herniation pains are actually pains that can be treated very easily. But I also want to say, don't focus on the pain. Now, like this doctor, I say, I started having a pain. This pain started for me too. Then it passed, our neighbor, the furniture maker, Hassan A.
Hello!
He suggested some things and it went away, Then after 6 months, I got stuck again just as I was getting out of the car. I got stuck and 2 to 3 people had to drag me home and all that. Anyway, we lay down and got up again. Someone suggested something and so on. Now everyone is a professor. Everyone has read the science and wisdom of this work. Recently, a patient came in, a relative. He says, we know that too. He says, I know a neurosurgeon. By knowing a neurosurgeon, he feels elevated in knowledge. So do I make myself clear? So please don't get me wrong. Please, please. There's no need to undress with the doctor. We came here we've lost our children. I'm sorry, but there's a huge accumulation behind this. We have read 3 to 5 times your height's worth of knowledge. We're still continuing to read. We're keeping up with the world. It's being renewed because, please, you will value and appreciate knowledge and wisdom from that perspective. And this kind of attacks keep coming. However, we are here because the pain has passed. Meaning, you experienced back pain in these incidents. It passed after a week. You experienced neck pain. It passed after a week. Just because these things have happened doesn't mean you're being treated. So your pain can be relieved. The body doesn't suffer from pain forever. In some way, your pain can be relieved. So what you need to do here is identify what the problem is. This is the diagnosis. We are professionals for this reason. So why did this happen? What was the problem? Why did I feel pain? And now, our diagnostic methods are very easy. After our examination, we do an MRI. MRI technologies are very advanced. Is it a hernia? What is it? What isn't it? It's a joint lock. Was it a muscle pain or just a simple ache? We can understand these very easily. And at the end of all this, if you have herniation pain, especially during these times, it will intensify, increase, and progress. Your pain will increase. It won't let you go. A herniation won't let you go. It won't leave you alone. It's a very insidious disease. It's cunning and is associated with the Taurus zodiac sign. Herniation resembles the Taurus sign.
Herniation Taurus.
It's stubborn, of course.
Oh my.
I know this because I am also a Taurus.